Management of dry animals, heifers and calves. Subject: Zoology, Semester 4, Paper Dairy Technology. Topic: Management of dry animals, heifers and calves. Learning objectives: understanding the importance of managing dry cows, heifers and calves in the overall success of a dairy operation. Identifying the key management practices for dry cows, heifers, and calves, including nutrition, health, and reproductive management. Identifying the common health issues that can affect dry cows, heifers, and calves, and how to prevent and treat them. Learning how to implement an effective reproductive management program for heifers and cows, including breeding, pregnancy diagnosis, and calving management. Outcomes: understanding the importance of proper nutrition for dry cows and the impact it has on milk production in the next lactation. Knowing how to manage heifers during their growing phase to ensure they reach their target weight and size for breeding. Understanding the importance of record keeping for managing animal health and production. Understanding the economics of managing dry cows, heifers, and calves, and how to optimize profitability. Management of dry animals. Management of dry animals. A dry animal means an animal which completes its lactation, and drying is essential to give adequate rest to the odor of the animal. An animal which completed its lactation period, that is called dry animal. Dry animals should be separated from other milk animals, other milk giving animals. In case of cow, dry cow can be treated for mastitis to prevent mastitis in the next lactation. Mastitis is a disease. To prevent mastitis in next lactation. The care for dry cows. The care for dry cows to prepare them for successful entrance into milking herd is detailed below. 1. Teat treatment. Teat treatment. A teat sealant is applied to the teats. It is a gel or paste that is used to seal the teat canal during dry period to prevent bacteria from entering the teeth. Nutrition. Dry animals require a balanced diet with adequate protein, energy, and fiber and mineral supplements. So this kind of food should be provided to the dry animal. Clean and dry environment. Provide a clean and dry environment for dry animals to rest and minimize the risk of infections. To rest and minimize the risk of infections. Exercise. Dry animals require exercise to maintain muscle tone and prevent obesity. Encourage animals to move around by providing enough space for them to walk and graze. Health management. Dry animals still require routine health management, including vaccinations, deworming, and regular checkups by veterinarian. Management of heifers. A cow that has not given birth to calf yet is called heifer, which has not given birth to a calf. That female cow is called heifer. Nutrition. These are the management of heifers. First one is nutrition. Heifers require a balanced diet with adequate protein, energy, and minerals to support their growth and development. Feed 2 to 3 kgs of concentrate daily for good growth and calving. Housing and environment. Provide a clean, dry, and comfortable environment for heifers to rest and grow. Reproduction management. Heifers should be bred at appropriate age and weight. Heifers should be bred at 24 to 30 months of age. That's the normal range. Health management. Heifers require routine health management, including vaccinations, deworming, and regular checkups. Monitoring their growth rate is important. Record keeping. Keep accurate records of heifer growth, reproduction, and health management to monitor their progress. Socialization. Heifers should be grouped with others of similar age and size to promote natural behaviors and minimize the risk of bullying. Minimize the risk of bullying. Management of calves or weaning calves. Calves are the young bovines that have not yet reached puberty. That means young individuals. You can see here the calf which is feeding on the teats of the mother. Early management. As soon as it is given birth, the management. Immediately after birth, remove any mucus or phlegm from those mouths, nose and mouth. So excess mucus that enters into the lungs and cause diseases. So that mucus should be removed from the nose and mouth. Normally the cow licks the calf immediately after birth. This helps in dry off the calf and also stimulates breathing and circulation. The navel should be tied about 2 to 4 centimeters away from the body and cut 1 centimeter below the ligature and apply iodine or boric acid or any antibiotic. So the navel should be cut after ligating it. The weight of the calf should be recorded. Wash the cow's udder and teats, preferably with chlorine solution, and dry off with clean cloth. Allow the calf to suckle the first milk of the mother, which is called colostrum. Colostrum contains the antibodies and rich amounts of protein that is required for the growth of the newly born bovine. So that should be given allowed to the calf. Feeding of cows. Feed colostrum, that is the first milk of the cow, for the first 3 days. The colostrum is thick and viscous, yellowish, slightly yellowish. It contains it contains higher proportions of vitamin A and proteins. The colostrum, which gives protection against many diseases. The limit of liquid milk feeding is 10% of its body weight. That means if the calf is 10 kgs, 1 liter, that is 10% of its body weight. Liquid milk should be given. Give calf starter feed after 1 month of age. Starter feed is the solid feed that is given to the calf after 1 month of age. Up to that age, it depends on only the milk. Provide good quality green fodder and hay from 1 month onwards. From 1 month onwards, we should give good quality green fodder and hay. Feeding of antibiotics to calves improves its immunity and makes it resistant to diseases. That is regarding the feeding of calves. Other management practices for calf. Identify the calf by tattooing on inside of the ear after birth and tagging after 1 year. So tattooing, that means a number should be given. It is attached, it is kept near the ear. Deworm the calf regularly to eliminate internal parasites. Fresh water should be given from second week onwards. Second week onwards. Mortality in calves is more during first month due to worms like ascaris, diarrhea, which is called calf scours, and pneumonia, lung disease. These are the three major mortality giving diseases. At 8 to 9 weeks of age, all the surplus male cows should be castrated. They can be used for other agricultural purposes. Keep the body of the calves clean and dry to avoid fungal infection. Mineral block licks should be provided to the calves to prevent mineral deficiency. The minerals are very much required for the normal growth of the calf, so they should be supplied in the form of block, mineral blocks, and they are kept here and there in the yard so that the calf come, comes and licks it and gets the required minerals for its normal growth. Thank you.